So this is a 62-year-old lady that presented with a non-ST elevation MI and was found then on transthoracic echocardiogram to have a large secundum atrial septal defect. She did have a TOE at her local institution prior to referral, which demonstrates deficiency to the aorta. Antigone, would you take us through the imaging?
Yeah, we see significantly dilated right heart, suggestive of a large left to right shunt at the atrial level. Starting to assess it now from systematically, again from 0 degrees. There's not much of primary septum. Posteriorly, we have 22 up to 23 millimeters in AP dimensions. With a short and mobile posterior, and you'll see its posterior inferior rim is quite thin and mobile. The aortic rim is small as well. And then going to the bicaval view again, you see this inferior rim that we're talking about that is quite thin and mobile. So this is the view from the left atrium. You see this oval-shaped defect, largest in the AP dimension, the thin tissue inferiorly. This is the IVC area, and then SVC. And then the dimensions 22 by 17 are the maximum we had. And total septal length approximately 48 millimeters.
Okay, so a number of features here that make this a very challenging ASD for us to close. I have little doubt that we're going to be using the 48 millimeter device, even though you might it falls within the range of the 44, but the deficiency to the aorta, the inadequacy of the septum inferiorly, are going to make this quite a challenge even with the 48. Do you agree with that, Antigone?
I think so.
So I brought a sizing balloon up. We'll just see what dimensions we get. So I take the balloon up here. Again, an implant super stiff wire in the left upper pulmonary vein, sitting nicely across the atrial septum there.
Still have
Do you have stop flow there?
Yes, no more shunt here. I think it's pretty well aligned. Oh, here's a bit of shunt.
Okay. There?
That's a good waste. No, no flow anymore.
Yeah, okay, all right. So it concurs fairly well with the TOE measurements, reasonable waste on the balloon. So I'm comfortable proceeding with the 48. It'll be quite interesting to see how it sits. So I've got a 16 French Cook sheath in the right femoral vein. And then we'll prepare a 48 millimeter device, please. So we've got a 48 millimeter device loading onto the monorail system of the implant super stiff. And then can you flush as we go through the sheath? Just take care as you take it through the sheath. It should run easily. So coming up now, Antigone.
Yeah, I can see the wire in the left veins.
The device there in the left atrium, taking the wire out. So coming back now with the catheter. Just bring the tip of
a little bit more.
Device to the end of the catheter. Come back till we're clearly free in the LA there. Yeah, happy with that?
Yes, you are. Yes, it's
and then
a
I'll
good position.
Unsheath this now into position here. Using the spine on fluoro and the TOE to guide the position here. Nicely mid LA. It's going to come out 40 millimeters. Okay, and that's the full extent of the device out. So now we'll form the left disc. Just need to advance a little so we're mid-LA there. And that's the left disc formed there. So coming back onto the defect now. You can see the aortic extent nicely, a little bit of tension there. You can see that the left disc is cupping now. So I'm going to bring out the right disc, nice and slowly. There's the waist, and the right disc's out there. And then just relax. Have a look at that and see what you think. Still fluoro.
As usual, 0 degrees are more difficult to assess when you haven't locked the device. It's just the tension there. Good distance from the mitral valve. Is a sizable device, so we need to make sure how it interacts with all the other structures. I haven't seen any shunt. And then going towards the bicaval view. Let's look at this inferior rim. You can see it actually nicely between the two discs, that inferior tissue.
Yeah.
It's quite satisfactory, I would say.
Okay, well, let's do a stability check. We'll just have a look. Can we go to LAO and we'll just show the device separation on fluoro. Camera's coming towards you, Antigone.
Yeah, plenty of space.
And then if you just cone in, just acquire a shot there. Yeah, so it looks like we've got good separation inferiorly and superiorly. And then if I stay in this projection, push forward, we should see the right disc cup, which you can see well there. Pull back, we should see the left disc cup, which you can see well there. So on fluoro and on echo, all of the check and the criteria are met for locking. So I'm going to go ahead and lock the device. I'll stay in an earlier projection so you can see how the device moves, and you can also be able to see on TOE. So a little bit of difficulty locking the device, which happens from time to time, but if you just fiddle with it and take your time, it's now locked. Still fluoro. So a little bit of movement, not as much as I was expecting.
There's not much space, is there?
Yeah. I'm just going to grab an image of that as well. And then we'll take our time to assess this on TOE, and then I'll see if I can align it better on the fluoro.
So far, very happy. Even at that deficient aortic rim.
Yeah, it's very good to aorta,
in fact, you
isn't it?
see that inferior rim there between the two discs. So I'm just going to do the final. Here again, the 8 petals. And then the right side is always a little more difficult to see the disc on the right side. But if you see the petals and you can count them all from the left side, it's quite reassuring. It looks nice.
Yeah, it looks good. It looks very good. Could you try going a little more lateral for me, a little more LAO? That's very good. Okay, I'm just going to acquire that. So we can see that the locking loop and the central wire connecting the left and the right eyelet there are well seen, and we can see separation inferior and superiorly. So fluoro and TOE, we're happy to release. So I'll release it slowly, and we can keep an eye on the fluoro and the TOE whilst doing so. Again, it's a little more difficult, a little more tension on the cord for the 48 device. And I'm supporting the eyelet with the catheter. Coming through now. Yeah, that's it released. Still fluoro. And then let's recheck.
Not changing the position at all. No new shunt. Beautiful position in the aortic rim. And similarly in that bicaval view. That's the superior rim. And then going forward. Inferior end. No shunt.
Yeah.
Very nice result.
Yeah, tricky defect to close, but I think that the final result looks very good. Thank you.